Cool. So I've already said this, but to the people who maybe didn't hear it, we wanted to ask everyone if it's okay if we record this meeting and put it on YouTube. If you don't want to be in our YouTube video, that's perfectly fine. Just leave your cameras off and you're not going to be shown in the video. So yeah, we just wanted to let everybody know. Okay, so let's get started. Hi, everyone. Thank you for joining our meeting. I'm Samara.
I'm Aditi.
And I'm Anjali, and today we're going to be talking about postpartum depression. All of this information has been verified by Dr. Bashir Ahmed.
So postpartum depression is depression that occurs in some women after giving birth, and it usually begins within 3 months after giving birth, but it may begin earlier, and it is a serious mental disorder that can impact everyday life.
Some of the symptoms of postpartum depression include trouble sleeping and fatigue, appetite changes, anger, crankiness, and sadness, being uninterested in the baby, thoughts of worthlessness, helplessness, or hopelessness, thoughts of death or suicide, and in severe cases, psychosis and infanticide may also occur. You should seek help if these symptoms persist for more than 2 weeks, or you cannot cope or function normally, or are having thoughts of harming yourself or the baby.
So, a less severe form of postpartum depression is also known as baby blues, and it develops within 3 to 5 days after giving birth, and it can last from a few hours to about 2 weeks. Baby blues do not need treatment, however, it does affect over 50% of mothers, and it usually results from the stress after having a baby. Postpartum depression is the more severe version of baby blues, and it's a serious mental illness, and it can occur within 3 months of giving birth. In severe cases, 1 to 2 in 1,000 deliveries develop psychosis, which it results in the mother losing touch with reality and also having hallucinations and delusions. And about 1 in every 7 mothers experience PPD, but often go undiagnosed.
So some causes of postpartum depression may include chemical, social, and psychological changes that occur after having a baby, a drop in hormones after birth, a history of depression or mood disorders, and also age. So the younger you are, the more likely you are to get PPD, and also the number of children you have. So the more children you have, there's a higher chance of getting PPD. Also having twins or triplets, having limited social support, living alone, or having marital problems, a lack of sleep and anxiety can all contribute to getting PPD.
So some risk factors that may increase a person's chances of getting postpartum depression are a prior history of mood disorders, such as depression, anxiety, and bipolar disorder, poor social support, including a lack of a supportive partner and or family, along with a family history of mood disorders.
If not treated, postpartum depression can last for months or even longer, and it makes you more likely to have episodes of depression in the future. PPD mainly affects the mother, but the entire family can have some spillover effects as well. For example, the father will be more likely to experience depression if the mother has PPD. In addition, children of mothers with PPD are more likely to have problems with sleeping, eating, crying, or even language development delays.
Some treatment for PPD includes anti-anxiety medications, antidepressants, and in severe cases, antipsychotic medications and mood stabilizers. In addition, psychotherapy, also known as talk therapy, is another treatment option, and this includes cognitive behavioral therapy, which can be abbreviated to CBT, which teaches women with postpartum depression different methods of thinking and how to react to triggers in order to improve their depression and unhelpful behaviors. Another form of talk therapy is interpersonal therapy, also known as IPT. And this helps by improving individuals' networks of relationship and support so that they can better deal with the triggers of their depression. And family members and friends can make the PPD worse by creating unrealistic expectations and unintentionally contributing to the stress of the new mother, which is something that can be treated with interpersonal therapy. In addition, transmagnetic stimulation and Spravato can be used in situations where the mother does not want to take medication. So transmagnetic stimulation is basically, it uses magnetic fields to stimulate the nerve cells in the brain, which are associated with mood. And Spravato is a nasal spray that is used to treat depression. And also support groups are another treatment option.
So here are some common misconceptions about postpartum depression. Some women think that they cannot take medications during breastfeeding, which is just not true. You can get postpartum depression after any pregnancy. In other words, a woman can have 7 pregnancies and not get postpartum depression, but she could get PPD after her 8th pregnancy. You can get PPD despite having no depression in the past, but having a prior history increases your chances of getting postpartum depression.
To prevent postpartum depression, tell your doctor if you have a history of depression, because having a history of depression increases your risk for having postpartum depression. Your doctor will be able to monitor your symptoms and may even give you medication. You can manage your mild depression symptoms with support groups and counseling, and you can get a checkup after giving birth. Earlier the diagnosis, the better. To cope with postpartum depression, you should ask for help and take rest. And be realistic about the expectations you have for yourself. Expect some good days, but you're also going to have some bad days as well. You should exercise and have a good diet. So that means no alcohol and no caffeine. Foster a good relationship with your partner, family, and friends. And you should reach out to your doctor, nurse, or midwife or pediatrician in order to start a treatment for PPD. Make sure you have a good support system and rest and sleep when your baby sleeps, because sleep is a very big healing factor in postpartum depression.
So chances are you probably know at least one woman who currently has or may have had postpartum depression in the past after a previous pregnancy.
Before, women were told that postpartum depression was a normal part of pregnancy and that the debilitating problems they faced were natural consequences that came with pregnancy. Only recently has more awareness been brought to this issue due to the decreasing stigma around mental illness.
If you know anyone who has recently given birth, make sure to provide them with support and spread awareness about postpartum depression. Many women do not know what postpartum depression is or that it can be treated. So spreading awareness and encouraging them to get help is a huge step forward to giving them the support that they need.
Here are some resources that or helplines that are available if you or someone you know has PPD.
Thank you everyone for joining us, and make sure to check out our website for more information by scanning the QR code. We'll be updating it with extra information about postpartum depression and different awareness projects that we have conducted, including interviews with professionals, including a psychiatrist and a clinical social worker. Also, please follow our Instagram for more at the PPD Project. Any questions? Perfect. Thank you so much, everyone, for coming to our presentation. We really appreciate it.